Some medical stories are about diseases, some are about miracles, and some exist in the narrow space between life and silence. This is the true story of a man who was declared dead twice and came back both times, and of the invisible signal inside his own body that almost took everything away. On the morning of October 14th, Daniel Harris woke up feeling exactly as he always did. No pain, no weakness, no warning. Daniel was 46 years old, an architect by profession, a runner by habit, a husband, and a father of two. He had never smoked, rarely drank, and had never spent a single night in a hospital bed. That morning he tied his running shoes, stepped outside into the cool air, and ran his usual 5 kilometers through quiet suburban streets. He waved to the same neighbor, stopped at the same cafe, ordered the same black coffee. He joked with the barista about turning older, and promised himself he would finally take a vacation next month. Nothing about this day felt unusual. Nothing about his body suggested that before nightfall, his heart would stop beating. At 9:20 that morning, Daniel stood in his kitchen, talking to his wife about weekend plans. Halfway through a sentence, he stopped. Not because of pain, not because of dizziness, just silence. His eyes fixed on nothing. His face lost all color. The coffee cup slipped from his hand and shattered against the floor. Daniel collapsed. His wife screamed his name. She shook him, called for help, placed trembling fingers on his neck. She could barely feel a pulse. By the time the ambulance arrived, Daniel had started breathing again. Weak, confused, alive. In the emergency department, the tests were perfect. Blood pressure normal, heart rhythm normal, brain scan clear. The doctor smiled gently. "Probably a simple faint," he said. "Dehydration, maybe stress." Daniel laughed. "Told you I'm indestructible." By afternoon, he was sent home. At 3:42 in the morning, Daniel walked toward the bathroom and never made it back. His wife heard the sound of his body hitting the floor. This time, when she touched his neck, there was nothing. No pulse, no breath. His lips were already turning blue. Paramedics began CPR in the ambulance. 30 compressions, 2 breaths. Again. The heart monitor showed a flat line. Asystole. Cardiac arrest. By the time they reached the hospital, Daniel had no heartbeat. In the trauma room, the team worked for 15 minutes. Adrenaline, oxygen, airway secured. Nothing changed. At 3:51, the senior doctor looked at the clock. Time of death, 3:51 a.m. The room fell silent. His wife collapsed into a chair. A nurse reached for the white sheet. And then, a voice came from the bed. Very soft, very clear. "Please, don't cover me." The room froze. The monitor was flat. No rhythm, no pulse. Yet the patient was speaking. Then, a flicker, a weak spike. Daniel's heart started beating again. 2 hours later, fully awake, Daniel spoke quietly. "When you said I was dead, I heard you." He described the room, the doctor's voice, the nurse crying, the exact time on the clock. Medically, impossible. His brain should not have been functioning. Yet, he remembered everything. That afternoon, without warning, the monitor went flat again. Asystole, no pulse, no breath. This time, the team waited. 10 seconds, 20, 30. And then, without CPR, without drugs, his heart restarted. On its own. 2 deaths, 2 returns, no explanation. Until a young resident noticed something small. Both collapses happened after Daniel stood up. A tilt table test was ordered. As Daniel was tilted upright, his blood pressure dropped. Heart rate slowed. And then, silence. Flat line. The diagnosis appeared on the screen. a rare reflex disorder. His own nervous system was occasionally commanding his heart to stop. The treatment was permanent. A pacemaker. A machine that would never allow silence again. After surgery, Daniel never collapsed again. 3 days later, he walked out of the hospital. Alive. Before leaving, Daniel told his doctor, "When everything stopped, there was no fear. Only quiet. And then, your voice brought me back." In medicine, death is not always an ending. Sometimes, it is a pause. And sometimes, the distance between life and silence is only one heartbeat long. If you believe real medical stories are more powerful than fiction, if you want to hear the cases doctors never forget, and the moments medicine stands between life and loss, then this is your home. Subscribe to Medinomy, because these are not just stories. They are stories that could one day save your life.